Yes, I'm with Lori Laughter, who is the owner of Dental IQ, a dental conference business in Napa, California, and she hosts the annual Napa Dental Experience. The meeting occurs every March. She is also a columnist for RDH magazine and often presents at RDH Under One Roof. And I wanted to talk with Lori about the column and her presentation at RDH Under One Roof. How are you, Lori?
I'm great, Mark. How are you?
Good, good. Your April column, which is coming up in a couple of weeks, kind of interesting in that you were talking about using the internet for alternative to research, alternative medicine. Can you tell me a little bit about about some of the cases you've been presented with?
Well, I like I started looking out for alternative dental treatments because I have patients coming in telling me about these treatments they're using, and there's not a lot of research behind them, so that's where the research started. And the cases basically, most of the ones I brought up this time were on oil pulling, which is a technique of using sesame oil or some other kind of oil to actually pull toxins, depending on who you read, pull toxins out of your body through your gingival tissue, and they swish this oil around, and then suddenly the oil becomes toxic with all of your body's toxins, and you spit it out, and then life is good. You don't have to brush your teeth. So I started researching on that, and it just led me to the idea that there's a lot of alternative dental practice techniques out there that we're not researching as a profession because A, we're very science-based, and B, we don't hear about them until somebody brings them to our attention. So.
Forward, and your at first examination of these patients, I noticed that you wrote that they appeared to have very healthy teeth, but during the examination itself, the story was a little bit different.
Right. Yeah. These particular patients, when they came in, had very shiny, healthy-looking gums, but as soon as you touched them, then there was bleeding, obviously, because they hadn't been brushing their teeth for these cases anywhere from 2 to 6 months, and just the plaque under the gum line was much more than I expected to find. A lot of calculus, a lot of bleeding, not so much health as it looked like when they looked in their own mouth.
Okay. And you, of course, turned to the internet at that point to find out more about this type of therapy.
Right.
And that was the point of your column, was to use the internet to explore more information about these alternative therapies. Can you tell me a little bit about some of the sites you were looking at?
I actually entered oil pulling in Google and came up with the sites that there's a few that promote this, but it all comes back to one person who did a study, and I apologize, can't remember his name, who did study on this oil pulling, and he says that when he looks at the oil under a microscope, he can see what he terms as bacterial embryos. I'm not sure what those are. There's no pictures. And that these were what the toxins were in the body. So all the websites that are promoting this oil pulling for things like curing cancer, curing intestinal disorders, curing inflammatory diseases, all went back to this one gentleman who had no real credentials. He called himself a doctor, and his one study of looking at this oil under the microscope.
I want to change the subject and ask you about your presentation at RDH Under One Roof in Chicago in July. The title of your course is called RDH Better Known as Healthcare Provider. I get the understanding that you're going to be talking about not just thinking in terms of being an oral health practitioner, but a healthcare provider. Can you explain to us where you're going with that?
Yeah, this is kind of the whole area that got me interested in doing something more in dental hygiene to begin with. It's the fact that we don't clean teeth, we don't just prevent periodontal disease, that oftentimes we see patients more often than their doctors, we see them more often than any other medical care providers, and we need to be alert, we need to know what's going on with our patients, we need to know when to suggest they see someone else, what signs we're looking for, simple things like that. And then one of the things that really got me started on this presentation was realizing that I had to go to a chiropractor. If you go to a chiropractor, you get your blood pressure taken. If you go to anywhere, they take your blood pressure if you're going for a health appointment. I know when I was ill before I had a hip replaced every time I saw a nurse, got my blood pressure taken. Yet most dental patients will tell you they do not get their blood pressure taken at the dental office. That we simply are looking at their teeth. And I think as far as our profession goes, because I'm big on keeping this profession going, we've got to make ourselves more of the healthcare provider industry. We've got to show patients and other healthcare providers that we're part of the team, that we're there to watch out for our patients' health.
Okay, well, we look forward to hearing the presentation that you are, and thank you for your time this afternoon.
Thank you. It was nice talking to you.